So there are several toothbrushing techniques and they all serve different purposes. But there are a lot of people that use the horizontal or scrub method. Unfortunately, this method of toothbrushing or this technique is very damaging to the teeth and then to the gums as well. So the horizontal or scrub technique, though it's very commonly used, is not a recommended technique of toothbrushing. In the horizontal or scrub method of toothbrushing, the toothbrush is held at a 90-degree angle to the tooth, and this causes damage to the gums and to the teeth when you brush this way, which is why it is not recommended. Now, the most recommended toothbrushing technique by most dentists is the modified bars toothbrushing technique. In this toothbrushing technique, your toothbrush is held at a 45-degree angle to the tooth, and then you move in a circular motion. Why is this a favorite of all dentists? Because the angulation engages the sulcus, which is the space between your tooth and then the gum. At the same time, it also engages the interdental space, or the space between the teeth. So whilst you move, you are brushing the tooth, you are engaging and getting rid of any debris that could be stuck in between the gum and the tooth, and at the same time you're getting rid of any debris that could be in between the teeth. So you move in a circular motion this way, and then you go all the way around. Now, a very important thing to note about toothbrushing is that you have to have a routine. You have to go in a systematic manner. So if you're brushing this way, you do the whole top so that you are sure not to miss any areas, and then you come down to the bottom. After you do the front of your teeth, you need to brush the occlusal surfaces of the teeth as well. So you brush all of the occlusal surfaces. You brush the same, you do the same for the top, so that you are going in a systematic manner. And a very important part of your teeth that you should never forget to brush is the lingual side. A lot of people forget to brush this side of the teeth. So you have to brush it outwards and get rid of all of the food debris and then the plaque that could be stuck in there. And then you do the same for the top. Another important part to always remember to brush is your tongue. You're supposed to brush it outwards this way. Paying very specific attention to the back of the tongue, because this is where a lot of the bacteria that cause bad breath hide. So you have to engage this part of the tongue and then brush outwards. You can also use a tongue scraper, which looks like this. You can find it at any pharmacy. And then you move this way in the same way that you brush with your toothbrush. You just move outwards with the tongue scraper, and this scrapes off all the debris from your tongue. It's very important to note this. You have to change your toothbrush every 3 months. Yes, every 3 months you need to throw away your old toothbrush and get a new one. You can also change your toothbrush whenever you realize that the bristles are fraying or they are opening up and moving wide apart. You have to change your toothbrush when you notice this. A good toothbrushing session should last at least 2 minutes. So you can even set a timer for yourself.